Well, good morning, everyone. Good morning. Where's the good morning? I mean, come on. Hey, here you go. I mean, like, well, it's a pleasure to welcome you to our, it's already 8th, believe it or not, cardiovascular imaging for the clinician. And I want to welcome you to Houston. I know several of you are from outside town, so hopefully you'll spend a great 2.5 days with us before you go back home. And for those of you from town, also it's a great time to be indoors because it looks like there is rain and the forecast is not the greatest, but at least you'll enjoy the company and hopefully you'll get to learn something about cardiovascular imaging and get updated. We have a wonderful slate of speakers that many of them are from out of town and certainly experts in their field. A few things for you. One is if there is, from a housekeeping point of view, if there is any conflict of interest, that's all detailed in your brochures and everything. So, and most of these conferences will be available to you on PDF. So they will be, if they're not uploaded already, they will be uploaded. So you don't have to take every note on every slide. What I'd like to do is, in the next 15 minutes, is just to give you a little overview of why we do this conference and few things about, Houston Methodist. And most importantly, to tell you the truth, you're going to be ready to text some of the answers because I usually like to do is quiz the audience as to a bit of their knowledge. It's not too specific. I know, we have not only physicians and cardiologists, but we have also sonographers and technicians in multiple areas. So this is the field. The field has an amazing explosion in technology. And I think it's very important for all of us as we use imaging to kind of put it in the context. And it is said, and I really agree with that, if you are in the field of cardiovascular medicine, you have to know something about imaging. It doesn't matter if you're an imager, if you're a clinician, if you're an interventionalist, if you're an electrophysiologist, heart failure, etc. It will touch you one way or another, and you'd better know something about what to order, what are the advantages and disadvantages of each one of these modalities, because nowadays imaging is really crucial in cardiovascular health. It is wonderful to see multimodality imaging, all these imaging technologies, but at the same time, it's really adding complexity. Complexity to how to navigate this and what to order, and knowledge about each one of the imaging modalities. Appropriate use is big, and particularly from, we are the custodians of healthcare dollars. And if you see appropriate use criteria, they were there from the inception almost 13 years ago to try to navigate this so we don't order every test in every patient. So therefore, you really need to know about that. Yes, some of the methodology that we use will give you some radiation exposure. The good thing is, as you will see today, that this radiation exposure has decreased significantly, and we have to think about cost effectiveness going forward. So this is for the emerging leaders and fellows in the field, but also for us who've been in this field for some time. This is where you're from, quite a few states, and also welcome people from Peru as well as Colombia, and it's a pleasure having you here. If you have not been to this area of the world, this is the Texas Medical Center in the forefront, and the background is actually downtown. So it's about the same size as downtown. It employs almost 100,000 individuals, and it is the hub of 3 big institutions: University of Texas with MD Anderson and Memorial Healthcare System, Baylor College of Medicine, and ourselves, Houston Methodist. And the arrow is where you're actually sitting today in the midst of this complex. Where you are is on the left side, and this is the Research Institute on the left. And in the middle is actually the new tower that you probably would peek at it, a little $850 million investment for predominantly heart and vascular that will be operational, will be our new home in June. So it's not too far from now. It's just about 14 cath labs, 4 hybrid rooms, EP, I mean, you name it, and I think it's gonna be a hub also for education. So hopefully we'll see you there. The other thing that we're very proud of, and that's why we do these conferences here, is on the 5th floor, and you'll go there tomorrow, this is called MIGHTY, basically a multi-area educational and simulation area, 40,000 square feet dedicated for education and simulation and training. And you will be able to feel that and have a good time in a small group sessions. We'll talk about that tomorrow. Whatever your area of interest, we're gonna poll you to go there, but I would encourage you to get out of your comfort zone and go and visit other areas of imaging that you're not. This is where you're gonna learn, not only brush up on what you know already, but I think, venture in other areas. And this is our team. Yes, we know we have a unique situation. It is a cardiovascular imaging institute where all cardiovascular imaging modalities are under one roof. So echo, nuke, CT, MR, and vascular is under the imaging institute. So therefore, what you're gonna hear from today is actually all these leaders in cardiovascular imaging telling you about how to navigate this. And we have a common reading room where fellows and physicians are interacting. So we're gonna ask you actually to text your answers. So if you go and maybe the best thing is to text Methodist to 37607, and once to join, that's it. You can test your answer, A, B, C, D, whatever it is, and even you can ask your questions there that will be at the end of each sessions will be there. So if you text Methodist to 37607 and wants to join, and then you text your message. All right, there are two special sessions actually. We'll have one today at noon while you're having lunch, and we're gonna treat you to a Texan lunch today and tomorrow. So we'll have two interesting sessions for you, and they are not CME, obviously. One is by Dr. Tommaso Mansi about artificial intelligence and cardiovascular imaging, and tomorrow is another treat, actually, at noontime. Virtual reality actually will be demonstrated here for you by Dr. Bernard Mum, who's president of TomTech, and now TomTech is a subsidiary of Philips. So I think you'll be treated to such a great thing there. All right. So these are some questions for you. So if you could text these, I have some questions for you. One is, what's your area of interest? Echocardiography, nuclear, CT, CMR. I don't perform or interpret imaging, but I use it clinically, and that's most likely why you're here. All right? So the quickest you could do that, the best for all of us. There you go. So some good clinicians also. Echo will always be the most common used modality, so I'm not concerned about that, and we'd love you to also venture in other things. So next one is, how long have you been in this field? Less than 5 years, 5 to 10, 10 to 20, more than 20. I've seen it all, but I'm here to socialize. All right. So we got it. Next. What's your area? I think the CT guys got there first. All right. Well, a lot of clinicians probably. There you go. I like that, because actually, in addition to your expertise, I think it's important, to know something about cardiovascular imaging. All right. A few things for you from a knowledge point of view. What do you use 3D for? 3D echocardiography. Improve assessment of gradients, validate MRI, help in catheter-based interventions, improve endocardial resolution, even if 2D is bad. Okay. I think you can poll the majority here. We're good. We use this also as a learning thing. Advantages of the newest CT scanners. Radiation dose is 12 to 14 millisievert. Better image quality, better temporal resolution, ability to use less contrast. Remember, this is except, huh? So which one is not correct? Okay, we need some learning here, guys. All right. 12 to 14 millisievert is still quite on the high side. Which of these echo methods can be used alone to assess degree of mitral regurgitation? Jet area, venous flow, conversions. All right, it looks like our echocardiographers are hitting the mark. EA ratio, simple EA ratio of mitral inflow is a reliable indicator of filling pressure, true or false. There you go, 50-50, I like that. Okay, I think we're good there overall. Nuclear, stress nuclear, a protocol of stress nuclear first as opposed to rest first should be adopted in many patients as it decreases the amount of radiation, less costly and more time efficient. Is it true or false? It is true, and actually you'll hear from Dr. Mahmarian about that. All appropriate indications for CT angiography, except chest pain, suspicious of coronary disease. So you're looking for the false one. Evaluation of suspected coronary anomaly, evaluation of cardiac mass, evaluation of LV function after a myocardial infarction. It is correct, below, way down. And the reason for it is you don't need all that knowing that you can have it with so many other things. I think the last one is myocardial viability by MRI. If I have a segment with more than 75% of delayed hyperenhancement, what's the likelihood of viability or improvement in function after revascularization? You're hitting it out of the park. I want to thank our sponsors who've really donated their grants to help sponsor this conference from year to year. Also the exhibitors, I would like to ask you to visit with them and see what the latest that they have. This evening, we'll have a reception. It's not too far, actually, it's a walking distance from here at 5:30 after you finish. It is at Third Coast, which is just across the street here. It's a very nice place, so we can get together and have some refreshments. The presentations will be there available for you, as you could tell. And I think it's time to start with our first session. We usually start this session with what's the latest in each one of the modalities, and then we can go into various areas. It is a pleasure to introduce my co-chair today, Dr. Randy Martin. Randy does not need any introduction. He's been really one of the fathers, actually, of echocardiography. He's not that old, but he's one of the fathers of echocardiography, past president of the American Society of Echocardiography. Really, I think, has had his pulse on all areas of cardiovascular ultrasound, but even beyond that, in valvular heart disease, the newer multimodality imaging. He was at Emory and Piedmont, and now really quite involved in artificial intelligence and new areas. So Randy, it's really a pleasure to having you in Houston. I know you haven't been here for a while, but it's really a pleasure having you here among us. And let's get started.